our study is about COVID vaccination and the general public. We've obviously had very good news in the last few days that it looks like rollout of mass vaccination will happen in the next year. So communication and engagement with the general public are going to be really, really important. We know that some people have concerns about COVID vaccination because the vaccine's been developed quickly. We know that there's a lot of misinformation out there, some of it intentional, about vaccination, which we're going to need to counter. We also know that rollout won't be straightforward. Some groups are going to be offered the vaccine before others. Some groups are going to have to wait. So we want to know how the public feel about that, whether they feel that's fair, whether they understand the basis of it. And we also know that rollout is going to be logistically challenging. The numbers involved, the storage requirements for the vaccination. It's going to mean people getting vaccinated in places and locations they've not previously associated with vaccination. There's going to be a considerably expanded vaccination workforce. So we need to ensure that people know exactly where and how the vaccine will be delivered and that they feel reassured by that. So communication and education with the public are going to be absolutely vital throughout. And we hope that our study will help the people who are in charge of vaccination campaigns and communications by providing them with real detailed insight into what the public need to know and how best to communicate that. So what are we doing? Well, we're conducting a large survey with a representative sample of the UK population, and we're also conducting in-depth qualitative interviews. We want to find out which group of people are most concerned about the vaccination, want to understand in detail the reasons for their concerns, how they feel about this idea of delivery being phased, and identify which sources of information and which media channels they most trust.